everybody. How are you doing? Happy Sunday. This is Dr. Elsie Coe with Lead Physician. Today, I'm so happy and grateful to have Dr. Marijka Gray with us today. Hi, Marijka.
Hi, Elsie. Thank you for having me.
Oh my gosh, thank you so much for doing this interview with me. Dr. Marijka Gray, I want to introduce you to her. She's calling all the way from Chattanooga, Tennessee. I'm in New Jersey. She is extremely passionate and supportive of physician leadership. And she has two major roles. Her main role right now is a systems director for the transformation implementation for Common Spirit Health. And I'll let her explain to you what that really means. And she's also the chief medical officer for Mission Health Healthcare Network, managing a significant number of lives. I think you said over 50,000 people.
Just about.
Yeah, so tell us a little bit about your first role, systems director of the transformation implementation. What does that mean?
Yeah, so Common Spirit is one of the nation's largest healthcare organizations. We take care of 1 in 4 Americans across the country. We're in 21 states and we have over 1,100 ambulatory sites. And my role is really working with my team and the medical groups across the country to really change workflows, to bring the latest technology, and actually to just leverage anything that we can to make the patient and the physician and clinician experience better.
Wow, that sounds like a lot. And then the other group that you work for, you told me it was an accountable care organization.
Yes, so we have a Mission Healthcare Network right here in Tennessee, which is a group of not only our employed physicians at CHI Memorial, which is part of the Common Spirit brand, but also our community physicians who work with us to manage approximately 54,000 lives in the Tennessee Valley and North Georgia.
That's amazing. So tell us why you are so passionate right now about leadership for physician being leaders in healthcare.
So I have in my career really ascended through leadership roles. I was previously president of the medical group here in Tennessee before I took on my transformation role. And before that, I was a regional medical director in Pennsylvania, where I had a group of about 800 physicians and APPs reporting up through me to the CMO. So it's one of those things where I grew up in an organization that was physician led. The CEO was a physician. And I've seen the difference that it makes having the senior leadership team made up of physicians and APPs, people who not only do clinical care, they know clinical care, and they know how it affects the patient. There are times when leadership thoughts and plans are made within a vacuum without that physician input. And 9 times out of 10, it is to the detriment of the organization as well as to the bottom line. So if you
Wow.
have the physicians at the table, they are really able to help implement and shape processes that can be easily implemented, as well as to have those start conversations with their peers in terms of why these choices are being made, why it makes a difference to the bottom line, and frankly, hopefully, why it makes a difference to the patient.
Right. I mean, that makes sense because people who are working at the ground level where the services are being rendered are the ones who understand how the processes are working, what needs to be changed. Can you just give us some examples of where you've seen a difference because of the physician-led organization that you were
Oh
in?
my goodness, there's so many. It starts with just basic workflows. And when you have someone who says, oh, if we make some changes, you can easily make a difference in colonoscopy rates or another screening test, where we know from a physician perspective that there may be a lot of institutional resistance or even community resistance. Different populations have different beliefs, and without really having that physician level insight of what they see on the ground day to day, of how patients react to different campaigns, we really can't target things towards them appropriately. So to be able to have that physician voice where they're able to influence how we approach things, and whether it is something like screening colonoscopies where you may need to take a longer term approach, or something like a seasonal flu shot and how to get folks in and what are the barriers to that, those are the things where the physicians can easily walk you through the techniques needed and really develop innovative workflows. Right now, drive-through flu shots are pretty common, but for some folks before the pandemic, they weren't. And it really took that physician and clinical leadership to say, you know what do you need to get a flu shot? You don't need to have the patient in, you don't need to have an appointment. 9 times out of 10, as long as you can get them registered, why not just have them drive up, stick an arm out, get the flu shot, make sure you have their information to bill and send them on their way. Things like that make such a huge difference for the patients and really respecting their time.
That's so good. Some of the obstacles that I came across as being a physician leader is that even though, as physician leaders in a group, we would come up with a really transformational and disruptive idea for the organization, but then it's hard to get the people who are beneath, or not necessarily beneath, but our colleagues to buy into it. How did you get, as a physician, other physicians, and does it take another physician to tell a physician how to change things?
So sometimes it does. What I've found is that usually it takes someone who they respect and who they know understands their clinical workflows. And some of that takes a little test of time to be able to establish that respect. To be a physician is usually a shortcut, but not necessarily guaranteed. And one of the things you find is that to get that level of physician buy-in, there are really two approaches. The first is the pilot approach, where you start with one practice, you do that, and then you spread from practice to practice, and the momentum snowballs because people look over and they say, what are they doing that's so different? Because it's working and they seem happier. How do we adopt it? The second is, of course, to really get that comprehensive physician communication to explain the why of what you're doing, to really get people to buy into the reason behind it and then to implement it. What I've found is that physicians, even when things are hard, they if they understand the why behind it, they can usually get around it if they think the organization is overall working for their own good. And not only that, but then you find some surprising upticks. So we've had cases where our specialty practices said, you know what, our primary care docs are working so hard on these quality measures. What can we do to help? Can we take more blood pressures when the patient is in? Can we give flu shots and pneumonia vaccines to these patients when they come in? And you have these physician offices offering to go above and beyond to really help the community as a whole on things that would typically be thought of as primary care. So it's really either doing that pilot and getting that snowball, or doing that really clear and crisp communication so that you can have that team buy-in. And if you do the second, you have to listen, because folks will say this won't work, or if it doesn't work, you have to be able to take that feedback and tweak as you go along. Because if you don't, you lose their buy-in forever.
It's so good. Thank you so much for sharing that. You had a CEO who was a physician. How was that experience?
That was amazing. It was interesting because he went from being chief medical officer to actually taking kind of a sidestep to being chief operating officer, and then led one of our hospitals before then going into the CEO role. So he was a great example of a physician who could really think around corners and not be boxed into a traditional workflow. And for me, that really opened up the thought process of, you know what, you don't have to go in one way in medicine. You could go in several different ways. But the organization was unique in terms of many of our system vice presidents were physicians. Many of the system vice presidents were nurses as well. So you had folks at the top who really understood the clinical workflows to a certain extent. And frankly, except for the highest tier of leadership, everybody kept clinical hours. So whatever happened, they were in the office at least one afternoon a week where they could really experience what was happening in the clinical setting and influence it, because they took that back to the boardroom with them.
Right. That's so good. I totally resonate with what you're saying about the data piece of it, because physicians thrive on data,
Yes.
thrive on, if you can show them that there is this, that pilot study you're talking about, that there's a significant change in the quality of care that delivered and the efficiency or whatever the cost changes, then you're really going to gain momentum by gaining that win. And
Yes.
now with EMR, and now with a significant number of applications that are coming out to help us, like Tableau, to help us gather information and make sense of it. That's awesome. And that communication piece, I feel like, a lot of times is missing, and
Yeah.
we're just being told what to do. And that's what really causes a lot of physicians to be very unhappy in their roles, and they don't feel like they're a part of it. Way to get physicians to be engaged, right? Is that
Yeah.
communication piece. And
Now, and I think the other part about data is that we not just thrive on data, but it has to be accurate data.
yes,
So the key is, if you're going to bring data before physicians, you need to know it cold. And you also need to make sure that there are no holes in it because they will find those holes. And
right,
it decreases your credibility immediately if you're not able to patch those holes or be able to explain through it. So it's really a matter of not only having the data, but having accurate data and then being able to go back and tweak the data if you need to, because one of the things that physicians are good at is that we love to play in the data. So once we get started, then we want to know, okay, what happens if we do this? What happens if we do that? I made this change here. How can I see my change? So to be responsive to that and have a data repository that the physicians themselves can basically tweak themselves and explore themselves is huge. I love having transparency across an organization because I think, sunlight is the best disinfectant. And what I found in one of my previous roles was that, when we exposed everybody's quality data, there was the appropriate amount of grief when some folks found that they were in their bottom third, but then they started moving the needle and they started paying attention and they started paying attention to things that made a difference for patients' lives. So, that those blood pressures that they may have had clinical inertia and said, oh, well, that's okay. We'll see you back in 3 months. We're now getting acted upon and medications were being increased and we're getting better controlled. And frankly, patients' lives were better because they had better controlled blood pressure.
right. So good. And I love the way you put it, sunshine and disinfectant and grief instead of blame,
Yeah.
right? We take responsibility for what we've done, but we're not blaming other people for not doing it. We're just saying, hey, these are the facts,
Yeah.
and let's together make this better.
Mhm.
So it's just the way you communicate that. I think is so good. Thank you so much. Marijka, tell us how you got to where you are today, and how can we get more women into leadership? I know that's one of your passions also. Just give us a little bit about your story, and give us some ideas on how we can get our leadership to be more diversified.
Mhm. So I think part of it and a key part of my story is just saying yes. I joke sometimes that I got into physician leadership because I accepted one too many meetings.
Okay.
There is that quality in terms of being able to tolerate a meeting that some physicians just don't have, that you really have to be able to do if you're in leadership. But when I first started practicing, a mentor of mine who actually recruited me to the residency program said, hey, we're starting an EHR. We really need a physician on the team. Would you be willing to give up an afternoon and be on this committee? Because between the travel time, the meeting time, it would be an afternoon of my time. And I said, sure. I was building my practice. I had the time to do it. And it was something that sounded cool. Within 6 months, it actually became 50% of my job description.
Wow.
And as I moved forward and I worked with the EHRs and EHR implementation, I realized that I loved the tech for what it could do for the workflows, but I wasn't the sort of person who loved the tech just for tech's sake. So, and our teams were exploring how do we utilize the technology and the EHRs to now make a real difference in patient care. So when our medical director of quality called and said, I have an opening for an associate medical director and I'd love for you to be on my team. I made a rookie mistake and I said no, because, we have all these different go lives planned and there's this happening and this happening. And my boss at the time, who was also a physician and a great influence, he called me up that evening and he said, here's why you're going to take the job. And he had
That's why
taken the
it's good to have a good mentor.
exactly. He had taken the time to sit me down and ask me about my goals, to ask me about what I wanted to do within medicine. He had sent me to an IHI coaching certification course to learn how to coach physicians. And he reiterated back to me what were my priorities, that I wasn't interested in being a CIO, that my main goal was to make life better for the physicians, and that the quality role would really fit into this better. So I joined the quality team, and when we did the quality work, we quickly learned that there was a lot of administration involved. And when my boss became chief medical officer, she basically absorbed her medical directors of quality into being associate chief medical officers. So by the time I finished up with that organization, I was regional medical director, and then I transitioned down to Chattanooga, Tennessee, to lead a medical group here of about 225 great physicians and APPs as the president. And then as Common Spirit with the CHI Dignity merger came together, they knew of my leadership in quality and transformation over the years and approached me for leading that across the organization.
Wow, that's amazing. And how many of those mentors did you have, or women?
You know what? So of those mentors, I'd say I've had three main mentors in my organization, in my life, quote unquote, previously. And of them, one was female. So I think the key things are, first of all, that men can be mentors too. As women, as we look to ascend in the leadership ranks, we often look for women to follow. And unfortunately, women are scarce at higher ranks. So don't discount men. Men have daughters. Um, they are out
And
there to be
wives.
your champions. Yes. So definitely if you have someone who you click with and they're able to really guide your career, take advantage of that. And then my female mentor actually was my attending during residency. She was the one who recruited me to the medical director role. And when she became CMO, I was her regional medical director and so on. So she really kind of took me under her wing. And as her career grew, she pulled me along with it, for which I'm truly appreciative.
Okay, so what are your recommendations for somebody? You kind of stated it indirectly, I think, in your whole path, but what's your direct recommendation for people who want to go into leadership?
So the first is to say yes. If you're approached and you're given an opportunity, a lot of times we second guess ourselves or we start to think, I don't have the qualifications for this role. And instead of saying that, just say yes. Say yes, jump into it. If you suck, people will tell you. So,
And if
but
you suck,
chances are
that's
you
okay. That's part of it. You're learning. I think
exactly.
as physicians, we're so used to making sure that we have everything all lined up before we
Yes,
can get to the next step.
yes.
So we need to be already prepared in our minds and say, what are my goals? Do I really want this? And then if that's what you want, even though you may not be prepared for it, just be prepared to say yes. That's what
Yes.
you're saying.
And I think the other part to it is if you're given a seat at the table,
Mhm.
occupy it. So there's so many times when folks get into a leadership role and they're there, but they're not fully participating because they're still doubting themselves.
Yep.
And the key is if you are given that leadership role, if you are given a seat at the table, you're there for a reason. You're there for your opinion, you're there for your thoughts. You should be expressing them because otherwise you're not living up to your full potential.
That's
And
right.
then, when given the opportunity, take it. It's one of those things where, as every step of my career as I've moved forward, one of the guiding principles has been, if I didn't try for this, would I be disappointed? And if the answer is yes, then I should be trying for it because, sometimes the opportunity gets to you before you think you're ready. And that doesn't matter. The opportunity is there now. You need to go for it. And if it's not for you at that point in time, it won't be. And that's okay because something else will come along.
That's so true. And also look for your opportunities. Don't just wait for them to happen to
Yes.
you. And a lot of, I feel like for me, that's the way I was. And I
Mhm.
think a lot of women, especially, we're socialized to wait until it happens and
Exactly.
bury our heads. Instead, lift your head up and look and be prepared for it to happen and look for
Mhm.
and that's when it's going to happen. So very
Yeah.
good. Thank you so much.
One of the things that I've seen is that people don't take advantage of their organization enough. There are so many times where you can call up the head of HR and have a discussion with them about where you want to be in the company and what would it take to move forward. You can sit in their office and have that talk. And it's people don't think of it because they think, oh, that's so much beyond me, or I can't do that. Those are self-imposed restrictions. So when you reach ahead and do it, you not only find that you get really great advice because everybody loves to be asked to give advice, but then you suddenly have champions in your corner or folks who now think of you in a different way, as opposed to just being that physician at this practice. They now know, oh, here's a physician who is interested in leadership. Here's a physician who's interested in quality. Here's a physician who's interested in technology. And when something arises, you are one of those names that pops into their mind for them to tap to be able to lead or help lead a movement going forward.
Yep. And I've heard people say stuff like, well, I'm not sure if that's what I want to do. I'm not sure that, when I take this role, I'm going to be doing too much technology. I'm going to be doing too much about the quality. And I don't know if I want to do workflow. But you know what? If you don't know, you gotta try. Try first. And like you said, I was in this role and I realized that I don't want to be the CMIO. I don't want to be the CIO.
Yeah.
I like the quality aspect of it. And you wouldn't know that unless you immersed yourself in that environment.
Exactly. And one of the things I have to say is that spending 5 years immersed in the tech and rolling out EHRs has actually really helped me in terms of now with the work I do, where I work with a lot of emerging technologies. I can sit through a demo and pick it apart and know what is real and what is smoke and mirrors. And really, those skills I would not have had if I had not had that in-depth training of really going through multiple EMR upgrades, multiple flashy sales presentations to really start picking apart what's real from what's not.
Right. And we were talking about this before, Marijka, but it's not just about being a physician leader within a organization or an ACO or a value-based care medicine or a network. It's also about being a physician leader in other sectors of healthcare, wherever it's in pharmacy, medical devices, in politics,
Yeah.
whatever. I mean, leadership is broad.
Yes.
Right. And physicians really need to be a leader in every realm of healthcare in order for this to work. So when we talk about, you need to be a physician leader, it's are you a leader in your office? Are you leading your teams appropriately so that care is being delivered the way it should be? That's cost effective with high quality.
Exactly.
Are we fulfilling the quadruple aim,
Yeah.
which you adhere to, with the fourth one being physician satisfaction with their jobs and not decreasing their burnout. So anyway, thank you so much for all of this. I really appreciate it. How can what are you doing right now in terms of, are you doing any coaching on leadership for physicians, or is that only within your network? And if people can reach out to you, how could they do that?
Yeah, so folks can easily find me on LinkedIn. I have a very unique name, so I'm easy to find. So, and
That's
the
great.
other part is I do kind of one-on-one mentoring. I do it ad hoc. I have a pre-med student who we're working on his medical school application. I have a couple other industry connections who we do mentoring and reverse mentoring together. I'm completely open to physician development or someone picking my brain on certain ideas. So yes, find me on LinkedIn. Feel free to reach out. I'd be happy to have a virtual cup of coffee with someone and discuss some of these ideas.
That sounds so awesome, and I'm gonna have to talk to you later offline about getting you on board to help me with other projects and my leadership course, Marijka, because I really enjoyed talking to you and learning about what you're doing. There's so much that needs to be done. We need to help our medical students and our residents early on
Yeah,
on leadership from the start, so we don't have to go back and learn what we should have learned from the start.
agreed.
So so on LinkedIn is when you can reach out to her. We'll put a little banner here for you so you can see exactly the spelling of her name. But thank you everybody for joining again. This is Dr. Elsie, co-founder of Lead Physician, an online program for physicians, not only individually, but for organizations. And we're going to start another round starting this January. If you're interested, please reach out to me at info@drlcco.com. Okay, thank you so much for listening on our weekly Sunday interviews with physician leaders. Thank you, Marijka.
Thank you, Elsie. Have a great day.
Okay, you too.